This is a topic we approach carefully because it can feel personal, but it is very important for long-term hair restoration success. With over 40 years of experience, we've seen that oral hair loss medications are sometimes underutilized, which can allow for more hair loss to happen over time. At Bernstein Medical, our approach is different. Whenever possible, we recommend oral finasteride and/or oral minoxidil to help set you up for long-term success. These medications matter because finasteride blocks DHT, the hormone responsible for hair loss in the first place, while oral minoxidil helps prolong the hair growth cycle and improve overall hair density. Together, they work as a strong team to support your results. Without finasteride, natural hair can continue to thin over time, even after a transplant, which may lead to an unbalanced appearance. When finasteride is used, it helps protect your existing hair while the transplant adds density, creating a fuller, more natural, and long-lasting result. It is important to note that treatment recommendations can differ for men and women, and not every medication is appropriate for every patient. For this reason, hair loss medications should never be started without first consulting your doctor. We understand that oral medications aren't right for everyone. If they're not an option for you, topical minoxidil and topical finasteride may be the next best step for men. Your provider will help determine the safest and most effective plan for your individual needs. We hope this was informative. Thank you so much for watching, and we'll see you in our next video.